Hey everybody, this is Rishi Agarwal, and in this video I'm going to be talking about the 4 features that you must know in order to understand interstitial lung disease. These are the 4 features right here: ground glass opacity, reticulation, honeycombing, and traction bronchiectasis. I put the definitions of them right below, and I got these definitions from the Fleischner Glossary, which if you haven't read it, you really should read it, especially if you're reading CTs at all. Let's talk about the first one, ground glass opacity. All this is an area of increased lung density with preservation of the underlying lung architecture. So in this example, this right here is normal lung, and this over here is abnormal ground glass opacity. But notice that you can still see the vessels underneath. So that means that this is ground glass opacity and not consolidation. Consolidation is an area of increased density that's so dense that you lose the underlying vessels and bronchi. The next feature I want you to know is reticulation. Reticulation is a thickening of the interstitium of the lung. So this over here, right here, is normal lung. And in a normal patient, the fine interstitium of the lung is so small that you're not able to see it on CT. But in patients with certain diseases like pulmonary fibrosis, the interstitium becomes thickened with fibrosis and cells that you start to see them. And so it shows up as this lacy kind of net-like appearance. Now, this is a sign of fibrosis, but it doesn't always mean fibrosis. Patients can have reticulation in the lung for other reasons, such as infection or pulmonary edema. So you have to be careful in calling reticulation fibrosis. You have to make sure that there are other signs before you call it definitely fibrosis. One of those signs is traction bronchiectasis. Traction bronchiectasis is a special case of bronchiectasis that occurs not because of an underlying inflammation of the bronchi, but because the lung around the bronchus is abnormal. The lung around the bronchus is fibrotic and it's pulling the bronchus open. And traction bronchiectasis has this characteristic corkscrew appearance. So when you see traction bronchiectasis, this is a specific sign of pulmonary fibrosis. The last feature I want to talk about is honeycombing. Honeycombing just means clustered cystic air spaces with well-defined walls, usually at the lung periphery. And in this case, rather than just one layer, there's about 3 or 4 layers of honeycombing all stacked up against each other. And this is another sign, a definite sign of pulmonary fibrosis. Occasionally, it can be difficult to tell honeycombing from traction bronchiectasis, and that's where I usually use the coronal and sagittals to determine whether I'm looking at honeycombing or traction bronchiectasis. So we're going to look at more examples of all 4 of these. This is the first example that I wanted to show you, and as I scroll through it, I'm seeing areas of increased lung density, but it's not so dense that it's consolidation. So this is something that I would call ground glass opacity. And let me blow it up here. Sometimes it's helpful to change the window and leveling to convince yourself that what you're looking at is real. And as I narrow the windows here, you could see that there's a big difference between this area of lung and this area of normal lung right next to it. So this is ground glass opacity. When I scroll through the bases, I'm looking for areas of fibrosis, specifically traction bronchiectasis and honeycombing, but I don't really see any in this patient. So this is just a pure ground glass opacity example. This is the second example I have for you. And when we go to the lung basis, we see that there's a fibrotic pattern. So I want to blow it up to see what we have here. What I'm seeing are dilated air spaces. They're about 5-10 millimeters in size. And they're all stacked up against each other here. So we have maybe 2, 3, 4 layers. So this I would call honeycombing. It doesn't really look like it's honeycombing in isolation though. And usually when you have honeycombing, it's not in isolation. Like for example, I have traction bronchiectasis right here. If I go anteriorly a little bit, here's a little bit of ground glass opacity. Here's a little bit of reticulation over here. But I would say that the predominant feature that we're seeing in this case is honeycombing. The prones can be very helpful because when a patient is lying supine, dependent atelectasis can collect at the lung bases here posteriorly. So when you put the patient prone, it removes the dependent atelectasis and you see the fibrotic pattern in isolation. Now here it really wasn't a mystery that we were looking at honeycombing, but you could see that the honeycombing is very sharp on the prone images. This is the third example I wanted to show you, and in this example, as opposed to the example that we just had, this patient has what looks like honeycombing, but it's only one row of honeycombing. So some people question, can you call that honeycombing? And the answer is yes. So if you look at it and you really scrutinize it, and you're pretty sure that you're looking at cystic air spaces and not reticulation or not traction bronchiectasis, it doesn't matter whether you have 1 layer or 5 layers. You can call it honeycombing. And in this case, I would call this honeycombing. Now, I can confirm that with some other views, like I have these prone images here. And on the prone images, that finding persists of these dilated air spaces with well-defined walls. So in this case, I'm very certain that this is honeycombing, despite the fact that we only have 1 layer. This is example number 4 for you. And let me blow this up here. So in the left lower lobe, what we have here is reticulation. So remember that reticulation means an increased thickening of the interstitium of the lung, but it doesn't always mean that the patient has pulmonary fibrosis. You can have edema or you can have pneumonia show up as reticulation. But if we look for other signs here, and I keep scrolling down, we see that there's traction bronchiectasis here. So this traction bronchiectasis is an indicator that this reticulation that we're looking at is actually fibrosis. Okay. Now, as we continue to look, I'm looking for areas of honeycombing because honeycombing is going to be an important predictor in the diagnosis of the patient, but I don't really see any. Okay. So in this patient, all we have is traction bronchiectasis and reticulation. This is the last example I have for you. And in this example, we see a lot of different features here. So in the right lung, there's areas of ground glass opacity, so increased lung density with preservation of the lung architecture. There's areas of traction bronchiectasis here in the right lung, as well as some traction bronchiectasis in the left lung. This looks like reticulation over here. More ground glass opacity as well. This is traction bronchiectasis. More traction bronchiectasis. So I'm looking for areas of honeycombing, and I don't really see any. But I do want to look at this area because I'm kind of confused whether this represents traction bronchiectasis or whether it represents honeycombing. Okay, so the best way to kind of problem solve an area like this is to open up one of the coronals or sagittal images. So I'm going to open up the sagittal images, okay, and I'm going to localize this specific area here and blow this up. So this area, what it actually shows up to be when I blow it up on the sagittal images is this long kind of tubular opacity or lucency here. So this actually represents traction bronchiectasis. Okay, so if you have an area that you're trying to decide between the two, traction bronchiectasis or honeycombing, be sure to use your sagittal and coronal images to help problem solve. Okay, so I hope this video has been of some use to you. In my next video, what I want to do is put all of these signs together and combine it with a distribution to help come to a differential diagnosis for ILD. If you have any questions about any of these 4 features that we talked about today, please leave a comment below. Thanks.